That is not normal. Being told to push through is not acceptable medical care. Hello and welcome to The Midwife Says. My name is Melanie and I am almost a licensed midwife in the state of Florida. Here I share evidence-based facts about women's health, pregnancy, birth, and postpartum. Today I am starting something new on this channel called Community Connect. Once a week, I want to do an episode where I answer all of your most common questions, because that is truly my favorite part of this work, is educating people on their own bodies, their own health, and giving you the tools to really take charge of your own well-being. So this is episode one of Community Connect, and I am so excited. So let's jump into it right away. Is it normal that my period has changed since my late 30s? It used to be clockwork, and now it's all over the place. Yes, and I want to say that with as much reassurance as I can. This is one of the most common and least discussed experiences in women's health. What you're describing is often the very early edge of menopause, which can begin in your mid to late 30s for some women. Here's what's happening. As your ovarian reserve naturally declines, your body produces more FSH, follicle stimulating hormone. This is the hormone that causes the eggs in the ovaries to mature, and this is what gets those eggs ready to be excreted during ovulation and then be fertilized. So this FSH is trying to recruit eggs. This surge can actually shorten cycles. You're doing more work in less time. You might go from 28-day cycles to 24 or 25. Then as estrogen becomes more variable, you can skip ovulation entirely, causing longer gaps. This is transition, this is not dysfunction. So here's what I would track. Cycles more than 60 days apart, bleeding that's so heavy that you soak through a pad in an hour or less, or spotting in between periods. Those weren't a conversation with your provider, but variability itself in a woman in her late 30s is almost always biology doing its job. If you're concerned with your mood, with your energy, with anything hormonal, the very first place that I would start and that I recommend my patients to start is a thyroid panel and an iron panel. This is not just testing TSH, this is not just testing T4, this is not just testing your hemoglobin, this is a full panel because we need the full picture, because sometimes the top numbers look fine. These surface level numbers that are what's called standard of care to check are fine, but if you dig a little deeper, then you find the root of the problem. So if you're ever concerned about anything hormonal, I always recommend ask for a thyroid panel and an iron panel. Next question. I feel completely different in the second half of my cycle. Anxious, bloated, not myself. Am I imagining this? You are not imagining it. What you're describing has a name. Most commonly, it's called PMS. Most of us have heard of premenstrual syndrome. This can also be called premenstrual dysphoric disorder, or PMDD. This is more severe cases. And what is happening when someone has PMDD is it's like PMS on another level. This can include rage, extreme bloating, extreme tiredness. You truly feel like a different person. More fundamentally, what you're describing is what it feels like to live in a body that is more sensitive to progesterone. A 2017 study in molecular psychiatry found that women with PMDD have a fundamentally different cellular response to something called allopregnanolone. I know I'm not pronouncing that right. Bear with me. I'm going to put the word up here on the screen. Anyways, a progesterone metabolite. So women with PMDD are more sensitive to this metabolite than women without PMDD. It's not about having more or less hormone. It's about how your brain responds to that hormone. You're not dramatic. Your cycle is a fifth vital sign, and the luteal phase is where many women's bodies speak the loudest. One evidence-supported tool for luteal phase symptoms is magnesium glycinate. There are so many different types of magnesium, and I can do an entire video on that alone, and I would love to. So let me know if that's something you're interested in. But specifically, magnesium glycinate plays a role in over 300 enzymatic functions and is involved in cortisol regulation. It's also involved in muscle relaxation and sleep, all of which crater in the luteal phase for many women. I recommend the Thorne brand magnesium biglycinate. Thorne is third-party certified. It's highly recommended by professionals, sports teams, these types of things. It's a clean and well-absorbed form that won't upset your stomach. There is a link to this in the description, and I want to be very clear that they are not asking me to use their product. This is a product that I trust, and so I sought out this link for you on Amazon, and so I'm linking it below. That's the same for every single product in this video. There are no sponsors at all in this video. So start tracking your symptoms in relation to your cycle day. Once you can see the pattern on paper, it becomes data, not drama, and data you can bring to your provider. Next question. And this one is wild to me. This is a question that nobody should ever get dismissed when they ask, but here we go. Let's address it. I've been told my period pain is normal and I just need to push through, but it keeps me in bed. Ugh. I want to say this very clearly. Pain that keeps you in bed, causes vomiting, or means you miss work or school, that is not normal. Being told to push through is not acceptable medical care. Let's talk about endometriosis. Endometriosis affects 1 in 10 women of reproductive age, and it takes, on average, 7 to 10 years to diagnose. 7 to 10 years of being told the pain is normal. Okay? That is unacceptable. Endometriosis can be found in many different ways, so talk to your provider about that. Again, I can do a whole video on endometriosis. Let me know if you're interested in that. The next thing is primary dysmenorrhea, pain without a structural cause. This type of pain is driven by prostaglandins. NSAIDs like ibuprofen taken before your period starts are actually the first-line evidence-based treatment and work much better prophylactically, meaning preventatively, than reactively. So meaning, because this pain from your period is caused by prostaglandins and the way that ibuprofen works in the body, it is more effective to take the ibuprofen before your period starts rather than waiting until your period has already started and then taking it as a response to the pain. Please advocate for yourself. Ask specifically about endometriosis, because if ibuprofen is not adequately controlling your pain, that is abnormal and it needs to be checked into further. Ask for imaging. MRIs are the gold standard for any imaging really in the body, but specifically for endometriosis, it is your best bet on getting an accurate diagnosis. If you are being dismissed, find a different provider. You need to find a provider who trusts you and takes you seriously. Your pain is data. How do I know if I'm actually ovulating? Your body signals ovulation in several ways. Egg white cervical mucus, a one-sided pelvic ache called Mittelschmerz, a sustained basal body temperature rise of about 0.2 to 0.5 degrees Celsius after ovulation, and often a subtle increase in libido. For confirmation on ovulation, you can do an ovulation predictor kit that detects LH surge that triggers ovulation, typically 24 to 36 hours before ovulation actually occurs. I'm going to link one down below. This is the Easy at-home ovulation test strips. It's a 50-pack. They are one of the best sellers on Amazon, and I chose this one because it's FSA eligible. And you can pair this one with the Premom app for automatic reading and charting. The link is down in the description box. You can also do a hormone testing kit, which I'm also going to link down in the description box. This tests your estrogen, progesterone, LH, and PGA, so it's more comprehensive than the test strips alone. It's a little bit pricey, but if you're looking for a deeper dive, this is definitely the route to go. A progesterone blood test drawn 7 days after suspected ovulation can also confirm ovulation has happened. If you're tracking and never seeing egg white mucus or a temperature rise, bring that charting data to your provider. Why do I feel so good right after my period ends and then fall apart again? Because you're riding the best hormonal wave of your cycle. Days 6 through 14, the late follicular phase, is when estrogen is climbing toward its peak. Estrogen increases serotonin sensitivity, improves sleep quality, sharpens cognition, and often brings a genuine sense of confidence and energy. This is your body at its most hormonally expansive. It's real. Enjoy it. Plan your hard things around it. This is the time to conquer life's challenges. I want to say, though, that if you feel like your life is absolutely miserable in your luteal phase, seek some answers. Follow up with your provider, find a new provider, get testing, seek out a functional medicine doctor, look into a midwife, whatever it is that you have to do to enjoy your life. Because I want to also say that yes, your follicular phase is your hormone peak, but the luteal phase should not be miserable. The luteal phase is your permission to rest. It's not there to torture you. Those are 5 of your questions this week. Leave your next question in the comments. The most liked ones becomes next week's topics. This is a collaborative channel. And if you want to start tracking your symptoms across your cycle so you can see patterns and come to your provider with actual data, I love the period tracker journal. I linked one down below. It's a beautifully laid out 4-year journal with daily symptom tracking, mood logs, and flow intensity ratings. So again, the link for that is in the description box. Thank you so much for spending your valuable time with me today. If you found this video helpful, please share it with somebody that might benefit from it. That also lets YouTube know that this is valuable information. Anytime you share, comment, or like, it lets YouTube know that this is worth sharing. Thank you so much for hanging out with me today. Take care of yourselves, and I'll see you next time.